Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about diabetic coma. So if you like the video related to my health, my way, I would like to request you all please do subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Now, what is diabetic coma? Diabetic coma is a life-threatening diabetes complication that causes unconsciousness. If you have diabetes, dangerously high blood sugar, hyperglycemia, or dangerously low blood sugar, hypoglycemia can lead to a diabetic coma. If you lapse into a diabetic coma, you are alive, but you can't awaken or respond purposefully to sights, sounds, or other types of stimulation. Left untreated, a diabetic coma can be fatal. The idea of a diabetic coma is scary, but you can take steps to help prevent it. Now, start by following your diabetes treatment plan. The symptoms are: before developing a diabetic coma, you will usually experience signs and symptoms of high blood sugar or low blood sugar. High blood sugar hyperglycemia. If your blood sugar level is too high, you may experience increased thirst, frequent urination, fatigue, nausea and vomiting, shortness of breath, stomach pain, fruity breath odor, a very dry mouth, a rapid heartbeat. Now, the low blood sugar, the hypoglycemia. Signs and symptoms of a low blood sugar levels may include shakiness or nervousness, anxiety, fatigue, weakness, sweating, hunger, nausea, dizziness or lightheadedness, difficult speaking or confusion. Some people, especially those who have had diabetes for a long time, develop a condition known as hypoglycemia unawareness and won't have the warning sign that signal a drop in blood sugar. If you experience any symptoms of high or low blood sugar, test your blood sugar and follow your diabetes treatment plan. Based on the test result, if you don't start to feel better quickly or you start to feel worse, call for emergency help. Now, when to see a doctor? A diabetic coma is a medical emergency. If you feel extreme high or low blood sugar signs or symptoms and think you might pass out, call 911 or your local emergency number. If you are with someone with diabetes who has passed out, call for emergency help and be sure to let the emergency personnel know that the unconscious person has diabetes. Now, what are the causes? Blood sugar that's either too high or too low for too long may cause various serious conditions, all of which can lead to a diabetic coma. Diabetic ketoacidosis: if your muscle cell becomes starved for energy, your body may respond by breaking down fat cells. This process forms toxic acid known as ketones. If you have ketones measured in blood or urine and high blood sugar, the condition is called diabetic ketoacidosis. Left untreated, it can lead to a diabetic coma. Diabetic ketoacidosis is most common in type 1 diabetes, but sometimes occurs in type 2 diabetes or gestational diabetes. Diabetes hypersmolar syndrome: if your blood sugar level tops 600 milligrams per deciliter or 33.3 millimoles per liter. The condition is called diabetic hypersmolar syndrome. Severely high blood sugar turns out your blood thick and syrupy. The excess sugar passes from your blood into your urine, which triggers a filtering process that draws tremendous amounts of fluid from your body. Left untreated, this can lead to a life-threatening dehydration and diabetic coma. About 25 to 50% of people with diabetic hypersmolar syndrome develop a coma. Hypoglycemia: your brain needs the glucose to function. In severe cases, low blood sugar may cause you to pass out. Hypoglycemia can be caused by too much insulin or not enough food. Exercising too vigorously or drinking too much alcohol can have the same effect. Now, the risk factors are: anyone who has diabetes is is at risk of a diabetic coma, but the following factors can increase the risk. Now, the insulin delivery problems. If you are on an insulin pump, you have to check your blood sugar frequently. Insulin delivery can stop if the pump fails or the tubing catheter is twisted or falls out of place. A lack of insulin can lead to diabetic ketoacidosis, an illness, trauma, or surgery. When you are sick or injured, blood sugar levels tend to rise, sometimes dramatically. This may cause diabetic ketoacidosis if you have type 1 diabetes and don't increase your insulin dosage to compensate. Medical conditions such as congestive heart failure or kidney disease also may increase your risk of diabetic hypersmolar syndrome. Poorly managed diabetes, if you don't monitor your blood sugar properly or take your medication as directed, you will have a higher risk of developing long-term complications and a diabetic coma. Deliberately skipping meals or insulin. Sometimes people with diabetes who also have an eating disorder choose not to use their insulin as directed with the hope of losing weight. This is a dangerous, life-threatening practice that increases the risk of a diabetic coma. So, drinking alcohol. Alcohol can have unpredictable effects on your blood sugar. Alcohol sedating effects may make it harder for you to know when you are having low blood sugar symptoms. This can increase your risk of a diabetic coma caused by hypoglycemia. Illegal drug use. Illegal drugs such as cocaine and ecstasy can increase your risk of severe high blood sugar level and conditions linked to diabetic coma. The complications left untreated, a diabetic coma can lead to permanent brain damage or death. That's all about the diabetes in this video. I hope you all liked it. I will definitely come with the next video with my another content. Till then, God bless you. Stay home, stay safe, take care of yourself and your family. Bye bye and take care.